Welcome to the Northeast Kingdom Voice. I'm your host, Scott Wheeler. Today's guests are from the offices of Dr. Les Lockridge. To my far left is Teri March, and she is a nurse practitioner. And to my immediate left is Lisa Austin, and you are an LPN. Welcome to the show.
Thank you.
So I guess we're here today to talk a bit about a variety of topics ranging from your role as what a nurse practitioner is to the upcoming flu clinics. Are you nervous?
Of course. Not really. But.
Yes.
Okay, first of all, since you're new to the practice, what is a nurse practitioner? Because we all know what a doctor is, at least we think we do, but what is a nurse practitioner?
Oh, okay. Well, a nurse practitioner it's a lot of things. In my role, I'm primary care. I'm a family nurse practitioner.
Okay.
So that means that I don't really want to call myself an adjunct, but basically I take care of people. So somebody's coming in for, it could be pretty much anything. So anything that a primary care provider would do, whether it's managing your diabetes, whether it's an acute illness, that kind of thing, I'm there for that.
Right. Now, do you work under a doctor, or are you like at the same level?
Oh gosh, that's a tricky question, the same level thing. But no, there's a lot of collaborative arrangements,
right.
And really legally, and it depends which state you're in, whether you work independently or not.
Right.
So really, it depends on which state you're in.
Right.
So, but generally, you will see nurse practitioners work with various other healthcare providers.
Right.
So it could be MDs, DOs,
Right.
other, PAs, that kind of thing.
Right. And I think your arrivals really it's not only good for Dr. Lockridge, but it's also good for the region because, we are having whether it's Orleans County or the United States, is we have a tendency to have a shortage of primary care folks, especially in this region. So I think it's really good for him, and I think it's really good for the people of the area. So
I think so. I would have to agree. I think there's I'm not going to say it's not glamorous primary care, but I think there's a little bit less interest in primary care, and there's a shortage. So there's a lot of specialties, but when it comes to the home-based person, there are, I think, too few of those people who manage the person in all their care. So, the one person could have diabetes or asthma or, or all these things, cancer, or a variety of problems. And so they have one person who's sort of managing the care of all these things. So whether they need a referral out to see their specialist, or they just need to be seen for some acute problem, they go to that one person who plays in the primary care role.
Right.
So.
in a previous chapter of my life, I actually served in the Vermont House, and I was on the Healthcare Committee, and we talked about the struggle of finding people to go into primary care, family medicine, because it's some people even within the healthcare community don't look at primary care as important, but in reality, primary care is as important as the specialist, and even sometimes more important, because if you have a good primary care doctor, you might never need the services of those specialists, because part of your job is not only to get people healthy, but it's also to educate people how to stay healthy. So your role and the primary care doctor's role is very important.
Yeah, I would have to agree with that. I think there's a very big part that education plays in how people become engaged in their health care and how they're able to take care of themselves and really avoid those pitfalls when they stop taking their medications or they're doing certain things that maybe make their disease process worse, that kind of thing. But yeah, it's that primary care person who I always tell my patients that, you know, it's that person who probably in the healthcare arena knows you best and has a good idea who you're seeing, and they know who you, what's been done, basically. So they coordinate the care. And education is a very big part of that process.
Right.
And I think it's very helpful, and people become engaged, and I think you have better outcomes.
Right. I think the one thing that's great about Dr. Lockridge's practice too is most of the time you're going to see your person. As in, if you're Dr. Lockridge's patient, you're going to see that. You're going to see him. And I assume that's going to be the case with you. You know, granted, there are going to be exceptions, but I think most people like to see the same face each time.
I think you're right. I think there's something to be said with familiarity, and there's definitely an issue of trust. And so when you build that relationship and you go through things with that person, the good and the bad, I mean, healthcare is exactly that. I mean, you're ill and you're not in a good place, and somebody's going through that with you, and you do establish a pattern and a relationship and trust, basically. So.
Okay, and you are an LPN. How does that differ from an RN?
Nursing is levels, essentially, and you start your levels sort of at the LNA, and LPN being sort of the median nursing, and then RN is a step above. It's obviously longer schooling. There's an ADN program, which is associate's degree. LPN is sort of below that. And then you have your 4-year RNs, which obviously have their bachelor's.
How long have you been with Dr. Lockridge?
I started with Dr. Lockridge's office in the early spring.
Right. How's that working out?
I love it. One thing that comes to my mind whenever people ask me, do I like my job, you know, I think, I don't feel like I'm working. I love my patients, and interestingly enough, when I interviewed, something Danielle said to me resonated, and we talked for a while, and she said, we truly love our patients, and our patients are the greatest patients in the world. And it didn't mean much to me at that exact moment until I met with Les a few minutes later, and in our conversation, he repeated and reiterated that same sentence to me. And then once I started working for them, I realized it made perfect sense. We do have the greatest patients in the world.
Right.
They are fantastic people, and you can't help but to fall in love with them from the moment you meet them.
Right. Well, you know, he's, because I'm friends with Dr. Lockridge, and so is my wife. We've got to know him on different levels, but he goes above and beyond. You know, none of us are perfect, but when it comes to his patients, he really does. He really works hard to do what is right.
Absolutely, I agree with that, and I feel our patients are a direct result of his care.
Right. And you know, the interesting thing is, he's kind of like a throwback in the sense of, it's like, you know, with Dr. Wood, or then there's the border health clinic, Dr. Tatum. There's very few of these people now, doctors, who are willing to work on their own because of all these state and federal mandates and all the onslaught of paperwork. But Dr. Lockridge actually jumped into this a few years ago on his own, and he seems to be making a go of it. 'Cause making a go of it on your own now is tough. And do you find there's a lot of paperwork?
You know, there is a lot of paperwork, but I have to comment on something that you just said. He's kind of a throwback. Okay, and that's interesting. Yes, but he's also very forward-thinking, I think, too, in where healthcare, not only where it is now, but where it's going. And I think we're doing some things, or talking about doing some things in the clinic that I think are going to be very exciting and very good for the community. So I think we're going to be able to offer some things that are not commonly found, and I think need to be there. So, and if you want to talk about it, we can.
That's true. You are a naturopath.
Right. So I'm a nurse practitioner, but also I'm a naturopath, and I'm licensed in the state of Vermont and also in the state of Arizona. So, that's the state where I originally was licensed. And so, naturopathic medicine is very much a different way to look at medicine. And it's more about restoring normal physiology rather than, when you have the cancer, you already have it, and therefore you treat and go forward. And the way we look at it is, okay, well, maybe the best treatment or the best cure for cancer is don't get it. So that's where we come in. Prevention it's our thing. So really, when you look at Les, and he's a throwback, but he's also he's looking forward, very much forward. And so to bring that into this clinic, these type of services with that kind of perspective, I think that's pretty important, and I think that's really something that we may be missing in our healthcare realm. As we bring different hats in under the same roof. So, we have the person for the body, we have the person for the mind, and now we have the person, who, well, I don't know how you really want to describe me, but it's natural medicine. Prevention is our key, is our forte, is our specialty. And so to bring this into this kind of arena and this kind of clinic, and to offer those sorts of services, I think that's pretty exciting.
Right. And when I say throwback,
I
mean, historically, while everybody's going in this direction, he has gone back to where he just. But do you think we'll ever go back to where there's going to be more people like Dr. Lockridge who operates independently of any institution, or do you think this is just the way it's going to be for healthcare from now on?
I really think that what we're doing right now it's not really sustainable. And I think if you look at us in comparison to other countries and the outcome, I think we probably spend, I don't know the specific statistics, I used to look at it, but we're pretty high up there as far as what we spend per person on healthcare, and yet we're almost last on our outcome. So although we spend a lot of money, we're really not very healthy. So I think the bottom line, what we're doing right now is not sustainable. So will we see more people like Les and how he's doing things? We might, because I recall days gone past of solo practitioners, family practices, that kind of thing, extremely successful. Very knowledgeable about their patient base and the excellent care. So I don't know. That's a good question. But I know what we're doing now in general with the big, wow, we spend a lot of money, and I'm not really sure we're any healthier.
In my other world, I have the Northland Journal, and I have been doing a series on healthcare in an earlier time, and one of the parts of the series is a multiple part piece on a fellow. His name is Dr. Frank Fioramonti. He was a doctor here from 1945 until the 1980s, to where he would actually, some rural areas, he'd have to take a car to a jump off point where he'd have to have somebody meet him to get him on horse and wagon, and a house call was like $3, and $3 to $5, and then or if you were pregnant, he would follow you through for, like, as he said, 7 months by the time you were pregnant, and delivered the child. That was $35. But he stays on top of things. He lives in Venice, Florida, but his son is Phil Fioramonti, who is Senator Bernie Sanders' right-hand man, even on the campaign trail. So he stays right on health care. And he feels that, this whole change that started, he said he saw it as early as the 60s, but certainly by the 80s, the health care that he knew he thinks today the doctors are some of the most highly trained, highly educated, but the way medicine is administrated, that their hands are almost tied. He said it's no wonder there's so many people taking prescription drugs now when you only have 15 or 20 minutes to see a patient. And he said he would never practice. He actually got done medicine in 1983 at 62 years old because he realized even then he could not adequately care for the patients. And but he says today's doctors are so highly trained, but
Right, and I think that we've created a system where we have a lot of people involved in care, and sometimes we don't know what the left hand, is doing. So it's become very complicated, very costly, and I'm not sure that we are seeing the benefit.
Right.
But I remember the doc of the day, and actually, yeah, my father actually.
he was one.
Yeah, he was one.
Oh, really?
I haven't seen anybody like that since. He would deliver the babies. He would take care of these people throughout their life. He did, he was the surgeon. He put the casts
sure.
on. He did he did all the stuff. And I mean, I remember people coming to our house, and it's like, my wife, she cut her finger. I remember this was one of my brother's classmates, and he said, okay, yeah, and he sewed her right up, but that's gone. We don't know that anymore. And I actually tell my children, don't go into medicine, but I can't because they want to. So, but I think it probably needs to change a bit, and I don't know if it's a litigious society that's done. I mean, I don't know. I'm not sure what the answer is, but I'm just hoping for some changes.
Right.
And because I just think that I'm not sure taking the pill or pills and all of the pills, I'm not sure if
Right.
that's the answer.
Well, the other thing good about your clinic over there is, well, the two of you are employed by Dr. Lockridge. He's also aligned himself with other people who, like, there's Dr. Don Harris, who's a chiropractor and a nutritionist. But then there's Sabile Anderson, who isn't employed there, but they work together, and she's a midwife, and so it's really become quite the little center over there. Of course, then you have Dr. Julian, who is still in there, and he's a
ENT.
ears, nose, and throat specialist. So you have a little bit of everything. Of course, then you have Catherine Matheson, who's a psychiatric nurse practitioner, and she was just on the show. So, and you are here to also talk about, you have a flu clinic coming up.
Yes, yep. We're going to be offering a flu clinic either in September or October, whenever the flu vaccine becomes available.
Okay.
We don't have the answer to that just yet, but I think it's important for us to discuss the flu in general. I think there's a lot of misconceptions as far as what the flu is. Often people think if their child or themselves are vomiting and having diarrhea that they have the flu, and that's a vast misconception. That is the stomach bug. The flu presents very differently, and Teri, you can correct me if I'm wrong, but often we look at more things. I usually tell my patients the flu is head to toe. The body aches, the fevers, the cough, the sneezing, sometimes nausea and vomiting come along with it. But it's not the primary, and it's also important for people to realize that less than 10% of people who receive the flu vaccine actually get the flu, which is somewhat of a surprising number to some people. There are people who don't believe in vaccinations and things like that, but vaccinations do help. They're very important in today's society. It takes one unvaccinated person to spread. And that's an unfortunate part of today's society, but it is reality.
Right. Yeah, because it's interesting. 95% of the time after I fly on a commercial airplane, I get something, just because of, as you were saying about the, whether it's a cold or something, that recirculated air, and just everything spreads really quickly. I am a wimp, and I don't deny it. If women, by the way, women are the strongest sex. Is no ifs, ands, or buts about it. Is I don't like to get sick. I try to avoid it at all costs. I'm horrible at being sick. I'm impatient at being sick, so I get my flu shot. And by the way, I don't really care for shots, but I care for being sick even less. So, but there has been, and I think there are documented cases where there has been reactions to flu shots, or to shots. But do you think the odds of an adverse reaction to the flu is far more dangerous than the flu shot?
I think not being vaccinated is far more dangerous
Right.
than having adverse effects. Certainly, one of the things that is important for people to realize, if you're going to get your flu shot, you want to make sure that you haven't presented with a fever within 24 to 48 hours prior to. If you are sick, your likelihood of getting the flu is a little bit heightened. It's a matter of just being smart about it, making good choices. Hand washing, obviously, being a very big part of it. But certainly the flu vaccine has proven to slow the flu, and obviously helped people, especially the elderly, people with asthma, children, pregnant women, your high-risk patients. It's very important for everybody to get vaccinated, but most specifically your high risk.
Right. So you don't know the dates yet? That's just
I don't have specific dates. We will certainly, as soon as we know when the vaccine is available, we'll certainly get that out there. That's the only contraindication with the flu shots, is that we don't always know in advance when they're up and ready to go.
Do you know yet, either one of you, how the stock of vaccines will be this year? Because there's a couple years, 2-3 years back, there was a big shortage. Do you know what it's like this year?
I think that as a nation we learned from that. I think that they've realized that more people are vaccinating than ever before, and I think they're hoping to rectify that problem, and every year the flu vaccine becomes a little stronger to combat the new version of the flu, which obviously gets a little worse every year.
Right. From a naturopath's point of view, how do you feel about vaccines?
Oh, wow, that's a loaded question. And I probably will defer that question. But no, I think it's, with vaccines, I think you should have that conversation with the parents, with their children's pediatrician and that kind of thing, and make an informed decision and go from there.
Right.
So I think it's an important issue.
Right. Yeah, because to go back to my buddy there, Dr. Fioramonti, who lived, he began being a doctor during the polio epidemics, and so his philosophy on vaccines, he was the Pied Piper of vaccines when they first started coming out. Like when he started, you didn't even have penicillin on the open market yet, and he said penicillin. When we used to have to, he said there was a big needle, and when they first came out, you knew you were getting a shot. He thinks part of the vaccine movement has been spurred on by there's less people alive today who remember the epidemics.
Mm-hmm.
Oh, yeah, and that could very well be. I think too. There's a lot of discussions going on. I don't think anybody has a definitive answer as yet, but I think there's a lot of issues with chemicals and chemical loads and how people are responding, and is it the vaccine or is it not the vaccine, and could be total coincidence. But the fact that kids are born with all these, I think it's something like 200 or so chemicals in their cord blood at birth. And then you introduce the vaccine, and this is not pro or con, this is just an observation and what we know out there. What's happening? How is this kid responding? And so, we have to look at that. We have to talk about it, and we have to understand what's happening.
Right.
So it's not like it was way back when. So
Right.
it's a different world today. So we're dealing with a lot of things. I think a lot of the illnesses we're seeing, some people say, well, is this a maladaptation to how our world is going? We have a lot of things we were exposed to. We weren't exposed to maybe those things when we were kids, but
Well, you know that even myself as a new grandparent now, we always we used plastic bottles. For some reason, I have it in my head that there's too much plastic in the. I might be totally wrong, but so we make sure they only use if they need bottles, they're glass. But that's only my little pet. I'm not a doctor. I don't pretend to be one on TV. But for some reason, I still think we have too much plastics, and especially warming up things in microwave. But again, I'm not a doctor.
yeah, but you're right. You're right, and you hear about the phthalate-free water bottles and that kind of thing because these things they act as we call them xenoestrogens, and your body recognizes it as an estrogen, and so you have kind of a feminization of men, and women are highly a lot of estrogen, that kind of thing. But yeah, it's just it's another chemical that's being introduced into your body from these plastics, and so again, this is having an effect. So you're seeing a lot of things with people, with children, and a lot of behavioral things. What's the association? So I think you're right. A lot of plastics. Should we be concerned with? Probably.
Okay.
Yeah, probably.
Okay, we only have a few more minutes left. Are you taking new patients?
I'm taking new patients, and actually we are in the process of looking at what we're going to be doing from the holistic, natural perspective, where people can come in and we can do diet, nutrition, clinical nutrition, orthomolecular medicine, using nutrients, using herbs. I mean, this really will be a place where when you hear, hey, you have to go ask your doctor, about whatever this herb is, we will actually know, okay?
Right.
We will actually be able to talk to you in an intelligent manner about this, okay? So since we've got the allopathic and we've got the naturopathic, it's a nice combination. So. So yes, we have these things coming down the pike, homeopathy, all of these things we're looking at.
But you're also able to prescribe.
Yes, yes.
I-
If you
is
need
it- is
an
it
antibiotic, I'm going to give you an antibiotic.
Right. Right. All right. One last thing though we didn't talk about is there's plans for a much needed walk-in clinic, even though Dr. Lockridge said it isn't going to be all the time, but they're going to really try to accommodate these people who otherwise would be walking who might end up at the ER in a huge bill afterwards.
Right.
So how's that going to work? Or is that-
Right. This definitely we are looking at accommodating walk-ins. Of course, there may be a wait time, that kind of thing, but definitely we encourage that kind of thing because it doesn't make sense to go into the ER for something as simple as you have cough or sore throat or something of that nature. Bee sting or whatever, some swelling or that kind of thing. Non-emergent things. There may be a little bit of a wait time, but definitely.
I think this region is in desperate need of a walk-in clinic. I think the emergency department has inadvertently been used as, and sort of abused as a walk-in clinic. And we're sort of utilizing services that aren't maybe necessary. We're having a walk-in clinic where we can see patients, as quickly as possible. As she's saying, there might be times when there's certain things that are slightly more emergent than others, where it might just take a little longer and having wait times might increase slightly. But, we're pretty good at what we do, and I think getting patients in and out, as quickly as possible is very important to us.
I know for a few years we did have I don't know if you recall Dr. Berger. He used to have a very, very good walk-in clinic, and it saw a lot of patients, but then he left the area. I guess there's a lot of challenges with walk-in clinics, but I just think it's just so needed, especially especially as I said, maybe walk into your clinic. I don't know what the walk-in fee will end up being, but I'm sure it's a lot better than no criticism of the hospital for their fees, but it is a ER, and I think there's more people walking into the hospital because of our shortage, our current shortage of medical professionals in this region.
Right.
Okay, a couple more minutes. Final words.
Oh gosh, final words. Well, thank you so much for having us on. I think this is very exciting what we anticipate providing and making available to the community as far as medicine as they know it and medicine as they might not quite be so familiar, but extremely effective cost-wise and otherwise. Very effective and very nice. And I think there's a lot of people out here who want this kind of medicine, and it's available.
And to schedule an appointment, what is the number?
334-7177.
Right. Okay, your final words.
Well, I want to thank you for having us and obviously pointing out the positive in our clinic. I think we do a lot for our patients and for the community. And I also want to point out that we will be having the flu clinic. We will be taking all insurances. Anybody who's uninsured, it's a $25 fee for the vaccine.
Right. Okay, well, thanks for coming on.
Thank you.
Thank you.
Right, thanks. And thank you for tuning in to another segment of the Northeast Kingdom Voice.